Second question. A 36-year-old woman presents to the clinic because of tearing and foreign body sensation in her eyes, which has gradually worsened over the last several weeks. She also notes having occasional palpitations, nervousness, sweating, and heat intolerance. Her past medical history is unremarkable. She reports a 20-pack of smoking history and is currently a daily smoker. Physical exam reveals an anxious, trembling woman. She has eyelid retraction bilaterally with an inability to fully close her eyes. Extraocular motility is limited on upgaze. The thyroid gland is diffusely enlarged. Laboratory studies reveal a thyroid-stimulating hormone level of 0.1 microunits per milliliter and a total T4 of 42 microgram per deciliter. TSI is positive. CT scan of the orbits show proptosis and marked enlargement of the extraocular muscles with sparing of the tendon. Which of the following may transiently worsen this patient's eye symptoms? So, okay, I'm not going to go too much into the details of this question because they're just pretty much asking which one, or rather, which of the options may transiently worsen this patient's eye symptoms. Specifically talking about your thyroid ophthalmopathy, okay, which is characteristic of Graves' disease. So when you look at the options, very easily you can arrive at option E, which is treatment with radioactive iodine, simply because the other four options actually help improve the condition rather than deteriorate it. Okay, external orbital radiation, not usually done because the treatment modality for thyroid ophthalmopathy is systemic steroids, as is given in option D. But even otherwise, orbital radiation can be done in moderate to severe eye diseases, moderate to severe ophthalmopathy or proptosis in thyroid disease. So as it benefits the condition, you can rule it out. Okay. Selenium supplementation, I personally never come across selenium actually helping, but I mean, I've read a little bit about it. So I guess it is being tried and it does seem to have some sort of beneficial role. Reason behind it, I'm not too sure, and I don't think it's been proved either. Smoking cessation does help because smoking worsens thyroid ophthalmopathy. And since this patient is a chronic smoker, asking her to stop smoking might actually help with the condition. So once again, it's more of beneficial effect rather than something that worsens it. Like I already mentioned, systemic steroids is the drug of choice for thyroid ophthalmopathy, and radioactive iodine in general worsens this. The reason behind it is when you're going to give radioactive iodine, it pretty much ablates all your thyroid follicular cells. So you can kind of imagine all your, the pent up hormone that is stored within the follicles kind of starts releasing into the bloodstream. So as a result of which, you're going to kind of have an initial phase of hyperthyroidism. So that transiently worsens. See, the key word over here is the fact that they're asking about transiently worsening. It's not like radioactive iodine worsens the situation forever, okay? Because it is one of the treatments for, hyperthyroidism. So you just have to look at transiently, and since this hyperthyroidism phase is only transient until the hormone levels die down, after which patient is going to go for pretty much hypothyroidism because the entire gland is going to be ablated.
Thanks for watching. Please give a thumbs up and subscribe for more.